thank you for joining us and welcome. I want to start by thanking MDH's Office of Statewide Health Improvement Initiatives and the SHIP program for the opportunity to be here with you today. We know that there are a lot of questions and thinking about how trauma-informed work translates concretely into PSE work. So we are really excited to be able to explore these questions with you. I also really want to thank Chris Haugen and Kim Edelman in particular for their help and guidance in developing this webinar content. It's been a truly collaborative process, and I feel like we are really on a journey together through this. We're going to start with some introductions and then also a little bit of a warm-up activity. If we're going to share, the four of us who are speaking today are going to share a little bit about ourselves, but in the meantime, we ask if you're willing to please put your name and where you work in the chat. And to help us clear our minds and center us on this topic, we also invite you to share in the chat something you want to hold on to for the rest of this hour or maybe the rest of this day, and something you would like to release so that you can focus on the discussion or on the rest of your afternoon. And we're going to also do this for you too, to model it. And so I'll start. So I'm Julie Ralston Aoki. I am the Director of Healthy Eating and Active Living Programs at the Public Health Law Center. I'm also a mom of 3 kids and an avid science fiction reader and a struggling ukulele player. I want to release some guilt that I have been feeling today because my elderly mom was dealing with a traffic court situation this morning. And as a lawyer, I sort of felt like I should be with her, but it's a 6.5-hour drive. And she reassured me that she was going to be able to handle it. And what I want to hold on to is the conversation I had with her earlier today, where she did, in fact, felt like she was on top of it. She handled it just fine. And so I am reassured that, things are okay. So Garin, would you like to go next?
Thank you. Yes. Hi, everyone. Garin Strobl. I'm a staff attorney on the HEAL team. I live in Minneapolis with my husband and 2 little kids and our dog, Winnie. One thing I want to hold on to is this thing. I've done it 2 days in a row now, is sit outside once everyone is out of the house and I have my coffee in the sun on our front steps, and it is glorious. So I want to kind of lean into this vitamin D energy that I've had lately. And something I want to release is this sadness that I always feel this time of year. It's the 4th of July, and I think about summer is almost over, and I'm going to stop that and just embrace that it is summer and we can still do things. So that is what I'm working on, and I'm going to pass it over to Safia.
Thanks, Garin. Hi, everyone. I'm Safia Abdinur, Policy Analyst with the Healthy Eating Active Living team at the Public Health Law Center. Similar to Garin, I think one thing I really want to hang on to is the amazing energy and wonderful weather we've had and the vitamin D and that I've received from my serene walks this past weekend. And then, of course, one thing I want to let go is some of that residual Monday blues that has come into my Tuesday. And I want to go in with that same energy I had from my walks this weekend, balanced and serene and calm. So yeah, and I'll pass it all to Emma.
Hi, everyone. My name is Emma Schubert. I use she, her, and they, them pronouns. I'm a research assistant here at the Public Health Law Center. Newly on the team and also newly in Minnesota. I'm here getting a Master's of Public Policy at the U. So new to Minneapolis this past year. One of the things that I want to hold on to is definitely the joy of this first Minneapolis summer. So green, so many blue skies. It's lovely and beautiful, and I want to hold on to it today and as the weather changes going forward. And something I want to release, I think, like you, Safia, I just want to release a kind of poor night's sleep and welcome a more refreshing feeling to the start of this Tuesday. So nice to see everyone.
Yes, thank you. And thank you for folks for sharing in the chat too. I'm seeing a lot of themes in the terms of releasing the feelings about our to-do lists and emails and whatnot. So I think very many people are going to be in that boat. Please keep it coming in. Please keep it coming in. Now, I want to tell you a little bit, for those of you who may not be familiar with us, about the Public Health Law Center. Hopefully many of you have heard of us, but in case you haven't, we are a nonprofit public health policy technical assistance center. And this is a picture of all of our staff, located at the Mitchell Hamlin School of Law in St. Paul, which, as maybe many or some of you know, we've learned is known as the Bedote region of the indigenous homelands of the Dakota people. This area is also home to the Anishinaabe and many other indigenous people from tribal nations who have made and continue to make countless contributions to this region through protection and stewardship of the land, air, and water, the preservation and revitalization of indigenous foodways, and demonstrating resiliency in the face of overwhelming odds. We recognize that the land that the Public Health Law Center currently occupies was forcibly stolen and comes with a legacy of U.S. law and policy aimed at attempted genocide and oppression of indigenous peoples, and that nonetheless, this land remains and will continue to be indigenous land. Now, as a law center, we also recognize that while the law has the potential to do a lot of positive things, which we talk a lot about in our work, we also have to acknowledge that it has been a tool of oppression, discrimination, and cruelty, especially to indigenous peoples and people of color. And so that is why we here at the center believe that it is a core part of our work to help repair and address this heavy legacy of the law and to apply ourselves in supporting tribal communities, native serving organizations, and their allies in using the power of law and policy to improve the lives of their community members and to help bring healing. Now I'm going to tell you a little bit about our focus areas. Our work is founded on the principles that everyone deserves to be healthy. And so we work to support advocates, researchers, community groups, and public health folks like you in developing public health laws and policies that are grounded in community and good science and lived experience and good legal principles. We focus on public health law policies to prevent and reduce chronic diseases and promote health equity. And we concentrate on the 4 issue areas that you see here on your screen, which include having culturally appropriate opportunities to be physically active, to have access to affordable, healthy, and culturally relevant foods, to help community members be free of the harms of commercial tobacco abuse. And we have a new climate justice project that is focusing on indoor environmental health issues for HUD and other types of affordable housing. What we do is provide what's legal technical assistance, or TA, which means legal research to identify examples of policies like we're going to talk about here today, regulations, court cases, or administrative and organizational policies about how they were implemented, what has worked for some places or jurisdictions, what hasn't worked so well. We can take this information. We often develop publications or other resources out of it. We do webinars, trainings, presentations like this one. What we don't do, though, is we don't lobby, and we do not provide legal advice. So for today, this is what we're focusing on. Our goal here is to help deepen our collective understanding of how PSE, or policy systems and environmental change, can be used to implement trauma-informed principles in a public health department or other type of worksite. We'll talk about what it means to be a trauma-informed workplace, why it matters, and provide some specific examples of trauma-informed policies and procedures. And I just want to note that we're trying something a little bit different with this webinar today. We're not saving time for just open Q&A at the end. We're going to try to do it as we go, and we'll have some built-in question prompts. But of course, we also welcome questions that you may have on your mind throughout. So just keep that in mind. We're going to go to the end. So Garin?
All right, thank you. So we're going to start today talking about trauma and what it means. And I know that a lot of you on this call are familiar with trauma-informed work, so we're not going to do a really deep dive into the background of the concept, but we wanted to take some time to talk about what trauma means in this context. So you'll see the definition up on the slide, and we'll be using the words trauma and trauma-informed in this presentation, but it's really important to know that there are a lot of ways that we can talk about our experiences that fall within the definition of trauma. So I think, when some people hear the word trauma, they may think about a specific event like war or an act of terrorism, and certainly that is trauma. But there are a lot of situations that we all experience that fall within the meaning of trauma as we use it in this context. So it could mean just being stressed. or overwhelmed or feeling burnout. And so, Chris Haugen actually pointed this example out to us when we were talking with her earlier about how we're all kind of experiencing this collective trauma of going through a pandemic and, trying to navigate how our lives have changed drastically overnight. So, I put up a few of the main categories of trauma, and really racism and other forms of discrimination are the most prevalent kind of trauma. So as a lot of racism can happen on an individual or societal and structural level, and it also underlies and compounds and exacerbates other forms of trauma as well. And so, there's sexism, homophobia are also examples of discrimination that can be trauma. Adverse childhood experiences as well, such as, neglect or abuse or witnessing violence at home. And then there's secondary and vicarious trauma. And that's also known as compassion fatigue, which a lot of people on this call probably experience because you are working in public health and you're working with people who have come with histories of trauma. And so, and especially again, with COVID, that is kind of imprinting onto you. And then, like I had mentioned earlier, there's specific traumatic events, but it's really important to know, we all come with some form of trauma, and people in public health typically serve these communities who have a history of trauma. So by understanding this concept, it not only helps our work internally, but also working with the communities we serve. So if we'll move on to the next slide, please. And we're going to talk about, trauma at work. And as I had said on the last slide, it's pervasive and it shows up in many different forms. One of the statistics we found said that at least 70% of American adults have experienced at least one traumatic event in their lives. I think that's probably higher. And as we talked about with COVID, we all have experienced some form of it. And so it's important to recognize that even though trauma affects all of us, it doesn't affect all of us equally. So trauma resulting from racism is pervasive and chronic, and trauma in the workforce has to be addressed by grounding this trauma-informed work in anti-racist policies and practices. So organizations that focus on or face chronic stress, like public health organizations, should really pay attention to trauma that exists in their workplace. Because if you have that chronic stress and then it's coupled with this kind of inner organizational trauma, then organizations can unintentionally harm or exacerbate that trauma in their own policies and procedures. And it can lead to a variety of issues that I have up here. So absenteeism and decreased workplace performance, increased depression and anxiety. You can have more turnover and also just re-traumatization by using some of these policies that may not be grounded in trauma-informed work. So, local public health organizations, especially since the COVID pandemic, have really felt, demoralized and undervalued after a lot of the work that they have done to keep people safe over the past few years. And then, they're faced with this pushback and criticism from people who don't believe that COVID is a serious health issue. And so having a trauma-informed approach in the workplace helps your employees and helps them feel more approachable and in a better position to assist community members. And by having that, you can gain a better form of trust between the two groups. And so understanding, the stress and the trauma that public health department staff and organizations bring to them to work every day, but also with their encounters with the greater community, can help guide compassion and understanding interactions with the communities they serve. And now Safia is going to take us through a scenario that kind of talks about those two groups and how they might interact.
Yeah, great. Thank you so much, Garin, for walking us through those definitions and talking about trauma and all the different ways that it can show up in ourselves and how we bring it to work. So to further build on this point of why it's so important to identify stress within ourselves and in others, let's walk through a scenario together. I'm going to present a brief description of a possible event that could happen at work. And I just want us to kind of reflect together and think about two main questions. And I'll pose the first question, and we'll put this in a chat for you as well. So the first question being, what are the points of toxic stress and trauma in this situation, and how does that impact your meeting with your clients? In this case, would be your community partners. And then the second question, what are some of the ways that you can incorporate opportunities for becoming trauma informed in this situation? So we'll put this again in the chat for you to reflect on as I go through the scenario. And in the end, I would invite at least 2 to 3 people to unmute themselves and others to also put in the chat your reflections and thoughts. So let's just set the context here. So you're a public health professional working with partners from diverse communities, which can include often the Hmong, Somali, as well as Latino communities. And communities that we know that have been historically disenfranchised and disempowered by government, and specifically governmental public health initiatives. So as a result, they may have experienced past trauma and may approach our efforts with skepticism as well as concern. So keeping that context in mind, let's talk about some of the important factors to consider when you're working with these partners. So here's the scenario. Imagine you're on your way to a meeting with community partners to discuss a specific project or SHIP activity that you're helping them with. But as you're headed to the meeting, you suddenly find yourself rushing because there was a last minute change with your childcare arrangements. So your regular babysitter had a conflicting engagement that they have forgotten to tell you about. So you had to scramble to rearrange your schedule and find a substitute babysitter, which caused you a lot of stress. Unfortunately, all this rushing made you late and completely flustered when you finally arrive to the meeting. So now let's just take a moment to reflect on that scenario. And I would invite you to think about that first question. What points in this situation do you think exhibited the toxic stress and trauma? And how does that impact the meeting that you're going in with your community partners? And again, I would invite a few people to unmute themselves, share their reflections for this first question.
I think Chris put in the chat. Thank you, Chris.
Thank you, Chris. Yeah, your own self-regulation is the best support for any situation. Absolutely, that self-awareness and identifying stress within yourself. So in this case, it's a lot, right? Like having to do last minute changes for your childcare arrangement is really difficult. Childcare in itself is a tricky situation, and having to rearrange that on the last minute, having to step away from your meetings and having to, take several different phone calls trying to find someone arranging that is incredibly stressful. Absolutely. Any other reflections or thoughts? So Carolyn says, may seem to not respect their time, not showing up and taking an opportunity to partner seriously. Yeah, absolutely. People might think that, you're not coming in and taking them seriously. And yeah, absolutely. I think that is a huge consideration of the respect element and your demeanor and how you show up to these meetings. And the first, absolutely. Thank you so much, Caroline. Yeah. And then, go ahead.
Oh, I was just going to say, I know when I'm flustered, I feel like I'm never my best self, and
Absolutely.
it's like harder to listen and just harder to be present too.
Absolutely. Distracted and feeling like you're not attentive also goes to Carolyn's point of like feeling like your community partners may not feel like you are coming in respecting them. Absolutely. And Casey says, if an employee is a single parent or has limited support, that may also increase their stress response with sudden childcare changes. Absolutely. Yeah. I agree. I think these are all really important. Those self-awareness, right? And also like understanding how the other person can also, perceive your certain stress as something negative, but really it is one of those things that sometimes you just can't control. So absolutely. And then, going into the second question too, kind of tying this together, what are some of the ways that you can incorporate ways to like becoming that trauma informed? What sort of approaches would you use in this situation? And thinking about some of the peace trainings that we have done, what sort of approaches and considerations would you implement in this situation? And this can be from the perspective of yourself, that self-awareness, as well as from your community partners. Yeah, Carolyn says, immediately apologize, address the reason for being late. Yeah, take everyone through a calm breathing and focusing exercise. Yep, stop, breathe, and notice, reflect, and respond. Yep, mindful techniques of breathing. I love that. Absolutely. Sort of kind of like what we did at the beginning. I think having some sort of an opening and welcoming, inviting. Icebreakers are always a great way to do that. Breath exercise work. I think we've tried to incorporate that within our own meetings here at PHLC, have been incredibly helpful. And yeah, Stephanie, definitely asking how to ask for help. Yeah. And also, what about like introductions? Something as simple as like reintroducing yourself can really help reorient it, like the purpose of, and also indicating the purpose of the meetings are also really helpful. Some of the other things too, yes, Casey says transparency with community partners about coming into meeting stress. Yes, that creating that connection through human experience. Absolutely. I think one thing that we have talked about in developing this webinar is also just within our own team is, we have to give grace for ourselves and also be gracious to other people, and understanding that things happen in life. And so if we can be able to practice that within ourselves, we should be able to really model that in our day-to-day meetings. Absolutely. Absolutely. And, and some of the other things too, and just to kind of wrap it together here, I think it's really important to also think about like the spacing too, right? When you walk into a room, similar to before introducing yourself, making sure that the room is comfortable and minimal disruptions, and like getting away from areas that might cause additional stress, something as mess even, making sure that things are not scattered. Another really great way of also relaxing yourself and also like being an inviting partner is as simple as like courteous suggestion as like offering water or a beverage or coffee when you first sit down. I think can kind of help you lay ground, and also like being able to know that like you're aware of your discomfort and your concerns, but also remembering that you have to meet people where they're at too. Being able to respond gently in a careful and very intentional manner is very important. And so with that breath work and doing some of that initial kind of or like orientation of like just introducing yourself can really help you with that. So and then also like another thing that can kind of help ground a little bit is thinking about how to do some sort of like a reflective debrief of like a previous meeting, and also like approaches to like what is the purpose of this meeting, and being able to get everybody on the same ground. So establishing some sort of like an agenda right at the beginning is also very helpful. So yeah, and then of course, and I think some people also identified this too right in the beginning, and we said one of the most important things in thinking about is considering that perspective of the community partners you're going in with, the considerations of the historical trauma and disenfranchisement and disempowerment of this group that you might be talking to. So like, and it's unfortunate, but knowing that you as a public health professional coming in from your organization has played a role, unfortunately, favorable as well as unfavorable conditions and outcomes for these communities that you are working with and hoping to improve. So important for to lead with cultural humility, self-awareness, cultural sensitivity, and being able to like really commit to that transparency and trust aspect. So absolutely. So thank you so much for all of your reflections and all of the great chats. I hope that as we continue to discuss this in the different ways that we're going to talk about the examples, I just hope that, this is just one example of a potential situation at work. But I think it really highlights just how being trauma informed and incorporating our learnings to our everyday lives, that, is something that you can't just cross off of a checklist. Rather, it is something that's ongoing, and it requires a lot of internal work, as well as being able to recognize that in other people. So in the following slides, Emma's going to actually walk us through 6 of the San Francisco trauma-informed principles. And then later in our presentation, we're going to provide some examples on how to operationalize those principles into your health departments and other work settings. So with that, I'm going to pass it to Emma.
Thank you so much, Safia. And thanks to everyone who contributed to that conversation in the chat. I want to uplift some themes that I heard from you all about transparent communication, mutual respect, and really bonding over a shared human experience. And I think that those little nuggets that I was able to pull out of that conversation really show that we're intuitively embracing a lot of these principles that I'm about to go through already. At its core, like we can see through that example, being trauma-informed is really about creating a culture of compassion, understanding, and respect. And as Safia discussed briefly, this is both an internally focused process and an externally focused one. And so going forward, I'm going to introduce some principles, and we're going to go on and talk through some policies and procedures that can address both the role of an individual, the role of an organization, and the role of relationships with the broader community. This bulleted list here is adapted by MDH from the San Francisco Department of Public Health. They've gone through a multi-year initiative to become a trauma-informed public health department. And these 6 principles are really going to guide our approach going through this webinar. So the first one, of understanding trauma and stress, emphasizes the importance of laying a baseline of shared knowledge and shared language across an organization. This can improve our capacity as individuals and our capacity as an organization for really taking the compassion-informed practices we just talked about and weaving them into how we work together. The second principle here, compassion and dependability, references using communication and support to build connections and improve our interpersonal relationships. Building these kinds of relational bonds across colleagues and coworkers, and also with community members and partners, can really create a culture of shared well-being within an organization and within a broader community. I think sometimes people talk about shared well-being through communication, and they're referencing a kind of politeness and niceness in the work environment, but truly being trauma-informed means creating a deeper level of trust and understanding that recognizes our diversity of experience and of reactions, and that values one another and one another's well-being, and recognizes that that's really intertwined, and that our shared well-being is really reliant on one another. The San Francisco Public Health Department has created a kind of respectful workplace culture campaign as a way of implementing that principle. This third one, safety and stability, is about reducing the threats to physical, social, or emotional safety. And it really builds off of those previous 2 principles, working to increase stability and minimize stress, both as individuals, as an organization, and when working out in community. We're going to move on to the last 3 principles. Collaboration and empowerment here is number 4. And this talks about seeking out opportunities for choice and control in the workplace and in decision-making. This principle, again, builds on the previous, because effective collaboration, choice, and control really require an environment of trust and safety among coworkers and throughout levels of leadership of an organization. This San Francisco Department of Public Health conducted a management training on collaborative leadership as a way to really infuse choice and control throughout levels of their work. And we're going to discuss more opportunities for doing that later on. Cultural humility and responsiveness references learning about the social, racial, ethnic, and cultural backgrounds to increase shared understanding and this shared sense of well-being. As Garin discussed at the beginning of this webinar, trauma comes in all forms, but trauma from racism and discrimination is a persistent and pervasive factor in the lives of our staff and clients of color. And trust and collaboration requires an active recognition and understanding of this, infused throughout the work of trauma-informed care. This final principle of resilience and recovery is maybe one that appears really internally focused on its face, talking about promoting personal skills and practices, strengths that can reduce the impact of toxic stress and trauma. Like some of you mentioned in that scenario, being able to take a second and do a breathing exercise before you enter the room. But you can also take this principle and look at it from an organizational and community-wide perspective. Workplace practices can actively support that kind of personal reflection and growth by allowing for flexible times and by promoting self-regulation practices in their work. So like I said, these 6 principles are going to guide us going forward. But I did want to take a moment to pause here at this next slide. We've just thrown a lot of information at you with those 6 principles and the scenario. And we want to pause and ask some questions, pose a couple prompts to the group here. So again, please feel free to respond in the chat, but we're also going to pause for a couple moments in case anyone wants to unmute and share with the group how you see trauma impacting your own workplace and where you see the relevance of a trauma-informed approach or any of those 6 principles that I just went over in your work. I'm seeing some responses come over here in the chat. People are beginning to make some connections. Lisa Wong says that they suffer from a lot of staff turnover. And we definitely see that, I mean, especially as you know, in the public health space, increasing over the past few years. Kaylee says a link to a respectful workplace campaign. Yeah, absolutely. We're going to be talking about that San Francisco example further on in the presentation.
And we can make sure to get that a link if there's, I think if there is a link to information about that, we can get that in the chat too.
Yeah, we'll drop that in the chat. Absolutely. A lot of responses coming in talking about communication with the community here in Minneapolis after the murder of George Floyd, references to linked communication and decision-making across levels of leadership and staff. These are some really great references. I appreciate everyone taking the time to think about their own workplace and really kind of bring these principles in to their understanding. Especially that comment from Caroline there at the bottom, seeing vicarious and secondary trauma happening in some departments. I think that's true, especially in a larger public health setting where some employees are more internally focused and some spend more time externally working with community members who may bear some of the brunt of that response. This is really fantastic, and I want to encourage everyone to continue to post comments and questions here in the chat as we go forward through the presentation.
All right, so now we're going to move into some of the examples of trauma-informed PSE, and we've broken it down into different areas of the organization where trauma-informed policies can play out. So that includes, a framework policy that really helps guide all of the other policies within the organization, such as office operations and HR. There's also customer service, physical and virtual work structures, and then also diversity, equity, and inclusion initiatives. So moving into the first example, it's the trauma-informed framework policy. And when we were coming up with this webinar, we were trying to decide the best kind of visual to associate with this idea. And we all kind of landed on this tree, and the idea that, the trunk of this tree really symbolizes having this trauma-informed framework policy, and then all of the branches kind of, branch off into the different sections of the organization, like HR, DEI initiatives, but they all come from a place of being trauma informed. So, this can extend to how a room might be painted especially if you're meeting with community members, having something that's relaxing. So everything is kind of guided by this framework. And so a lot of times, organizations who have this framework are called healing organizations or understanding workplaces. And really the goal is to recognize the way of that compounded stress can affect all of us. And then you create systems and policies that build a culture of well-being so everyone can thrive. So when we were doing research in some of these entities, we found a lot that shared this central framework, and they really focused internally, but also externally on the people that they serve. And the example I'm going to talk about is the Michigan Health and Human Services Department. And I'd like to thank the Minneapolis Department of Health for sharing this example with us. It's a really great example. And also we felt transferable to a lot of other health departments. And so, one of the things that they did was forming a committee, which is usually how a lot of things start. But really, having a committee that has people from all different parts of the organization and all different, if it's a very hierarchical organization from the top all the way down, being part of this committee. And ideally, if an organization is able to have someone who's full-time, or at least part of their work is really committed to trauma-informed policies throughout the organization, that is great. But we recognize that, a lot of organizations may not have that capacity. So just simply having this committee to really take a look at, the policies that an organization has, and seeing how they work throughout the organization and really looking at them through a trauma-informed lens. And so, part of the work and committee in creating these policies are really looking at, are these policies necessary? Like, do we need all of these rules and things to follow? And then if the committee decides, yes, we want to keep this policy, this is important, thinking about, does it hurt any of our employees, or maybe even some of the people we serve? And does it help anyone? Who does it help within our organization? And trying to kind of piece that out in part of your analysis on guiding the policies and procedures in the workplace. So that is step one. Then the next step really that we've seen a lot of organizations do is an initial training. And so that can extend to obviously your employees, but also volunteers and contractors. And the point of the training is really to get this initial grounding of the trauma-informed work, so everyone is starting from the same place. And then once you've conducted the training, doing a self-assessment and trying to make sure that where everyone kind of is with the concept of trauma-informed work, so that you can build future trainings on trauma-informed care. And then also thinking too, when you're doing these self-assessments, keeping in mind too, the knowledge that your workforce may have on the people that you're serving and the traumatic histories that they come from as well. So then the next step then is supporting community organizations and the partnering organizations that you work with in their trauma-informed work. So, this trauma-informed framework policy really embodies kind of all of the San Francisco trauma-informed policies, but I feel like it especially connects with the principle of understanding trauma and stress and ensuring that the organization is fully able to activate that goal. And now Emma is going to walk you through some trauma-informed policies that can work in office operations and HR procedures.
Thanks so much, Garin. Having a framework policy like Garin explained can be really essential. to creating culture change in your workplace. But policies can be implemented across departments at a much smaller level to also help a change happen across levels of leadership. Part of that can begin at hiring, which is really the beginning of an employee life cycle. Intentionally communicating values and intentions during the hiring process can help organizations create transparency and build trust with their prospective and soon-to-be employees. Some of these hiring practices may already be implemented, but might not be called trauma-informed. They could use other language. For example, the city of Minneapolis, other cities in Minnesota, and like this example here, the city of Madison, Wisconsin, have gone through equity processes in their human resource departments that really align with a lot of trauma-informed principles. So the city of Madison has started to have a lot of conversations around minimum qualifications in their hiring process and job postings. They have created a policy to allow the HR director to designate applicants for jobs with potential, but who may not necessarily meet the outlined requirements for a position. They bring other skills and experiences of value. This can often look like having conversations with your team around education and experience minimums, making sure that you aren't missing out on a candidate that may bring other experience, community connections, but perhaps doesn't have a bachelor's degree for an entry-level position. And you realize, that position doesn't really require the bachelor's degree. We're going to value some of these other points of experience. So trauma-informed work isn't always coming in the form of a concrete policy like that hiring policy, though. A lot of simple organizational practices are also important in shifting workplace culture. So in hiring, that could look like reiterating your values during the interview process and making sure to communicate well with your prospective employees, whether that be timeframes for their selection, how salaries and benefits are negotiated, or making sure to inform applicants who aren't selected for employment. I'm sure we've all had that experience of applying for a position, maybe even going through the interview process and having to assume that we weren't selected because we didn't hear that communication. So even implementing a practice as simple as sending out those emails is a really clear way of operationalizing the trauma-informed principle of compassion and dependability and really instilling trust and communication in those relationships. After hiring, though, the work doesn't stop there. In order to make a trauma-informed workplace, that has to be lived out in the everyday interactions of an office environment. A lot of that comes down to supervision strategies and management level practices. So providing consistent and scheduled time for supervisors to be present with staff can create opportunities for clear expectation setting and shared problem solving opportunities. Providing staff development at the management level that encourages joint problem solving can be really important, but it doesn't always occur in a training setting, including a staff debrief time at the beginning of a meeting, for example. Or if you know that perhaps your work is entering a really busy season, and so you want to carve out time around problem solving for self-care needs of your staff. Those types of supervision practices can help both help understand trauma and stress and how they're impacting your employees, and also make sure that you create dependability and open lines of communication across leadership to really operationalize those principles. This next slide is going to be talking about customer service policy, but we aren't really referencing the people that you call to talk about your phone bill. We're using the term customer service to describe any external facing interaction that your public health department might have with community partners, clients, and really all those that we serve. We know that caring and thoughtful community engagement and customer service requires employees who are well cared for. So allowing a break time policy that is flexible to ensure self-care and well-being practices can happen with your staff can be really important, especially for those employees that have a more external focus to their work. Often break time policies are written around meal breaks or non-meal breaks, but changing the language in a policy can open up flexibility. So creating a rest break policy or an unforeseen break policy, that shift in language can encourage employees to be able to take a minute when they need it. If we go back to that example from Safia in our scenario, if you're able to take 5 or 10 minutes at the end of that community partners meeting, which was stressful for you, to really regroup and center yourself before focusing on the rest of your work, you are going to be able to show up more engaged to the rest of your day, even after a stressful interaction. So changing that language around policy comes from, a lot of the values stem from organizations that have already done similar work around lactation policy. There are a lot of examples of creating flexible work time for breast and chest feeding employees. So that's a great place to start. Mandatory trainings on self-regulation and de-escalation examples can be especially important for external facing staff. The San Francisco Department of Public Health has created a level setting training for all employees, but also other levels of training for different facing employees. So there's a train the trainer training, which has some beautiful alliteration and helps infuse trauma-informed practices across the organizational level. But there are also management training on collaborative leadership practices, de-escalation techniques, and nonviolent communication. The Indian Health Service, for example, requires those types of trainings as a part of their trauma-informed training for staff. So making sure that you're taking into consideration exactly what the work of your employees is when you're tailoring a trauma-informed approach to your workplace. That can really help with the resilience and recovery of your staff and mitigate burnout and compassion fatigue, which can help with that last principle of the San Francisco 6. I'm now going to pass off to Safia to talk about the different types of work structures that we can encounter.
Yeah, thanks, Emma. Yeah, so I think we all know like our surroundings and physical environments have a significant impact on our emotional and emotions and mood. So, and of course, there's a body of literature that shows the links between our emotional well-being and our physical environment. So, in considering the San Francisco's principles of safety, stability, as well as cultural humility and equity, the creation of serene, secure, and inviting physical spaces that acknowledge and respect the diversity of your staff, clients, and community members plays a huge role in alleviating some of that stress in the various forms of threat to the physical and social and emotional safety of those who you work with in those areas, as well as the staff. So, and again, like in our initial scenario, we did like emphasize the significance of like showing up with our demeanor and when we're entering meeting spaces and how we arrange our space and to creating a welcoming environment. So we even touched on like the importance of considering something as a small gesture as like offering beverages for and ensuring that the meeting room is appropriately prepared. However, we are aware like that staff members may not always have the opportunities to actively participate in how like and influence how organizations and leadership design the workplace or establish policies that integrate trauma-informed special design. But you know, still adopting a trauma-informed approach to design choices and being that intentional on how we arrange our meeting spaces can significantly contribute to increased stability and even play a role in fostering that sense of like healing, safety, and cultural humility. And, you know, in recent years, we've, you know, seen numerous clinics, hospitals, and other workplaces adopt like a patient and community engagement process as part of like their integral like aspects to design. So like by embracing that cooperative and interactive approach, these organizations are actively involving their community members and their clients in that co-creating really critical rooms such as like prayer rooms, waiting spaces that really foster that welcoming atmosphere that prioritize that mental well-being of their clients and those communities that they serve. So I'm not sure if you can see this photo, but this photo really illustrates that here. So this is a picture from the Peter Christensen Dental Clinic on the Lac du Flambeau reservations. As you can see, the walls of this dental clinic is covered with native artwork, which was constructed by the members of the Lac du Flambeau tribe. In addition to their amazing artwork, as you can see in this photo, the ceilings are covered in bark from trees that they've harvested from their reservation. So I also want to note that, in this space, there's also nature elements, relaxing colors, comfortable furniture, and lots of lightings to help create that healing environment. But more importantly, it's a reflection and a symbol of members of their community. It's, in one of their articles, and we've linked this in our slide, they described the space and they mentioned the impact, stated it as like astounding. They went from like not having a dental clinic and now that's serving not only the Lac du Flambeau tribe and patients, but also neighboring cities and communities. So all of this really, I think, demonstrates that importance of the principles on safety and stability, as well as the culture of humility and equity. And then, another example relevant to our work post-pandemic, I think, is, organizations establishing a formal telework policy. Take, for example, the San Mateo County in California. This organization has actively promoted teleworking as a voluntary option for its employees and encouraging departments to establish formal telework that is very specific and tailored to the needs within their area. So this can include things such as alternative work schedules that allow for flexible hours for the employees, those 8-hour shifts for employees who work like the 8-hour shifts 5 times a week. So being able to flex and doing those 40 hours in 4 days or the 80 hours in 9 days, often referred to as like the 410 and 980 schedules. So by recognizing, this organization, by recognizing the benefits of telework, and such as like things such as like the reduced absenteeism, like that's due to a lot of it as stress, increased employee morale, as well as benefits such as like increased productivity and overall work-life balance. Policies like this really, I think, is one way for organizations to promote the principle of the collaboration and empowerment, because it allows for staff to make the best choices for themselves, feel empowered to foster their own well-being. And it can also foster a sense of like feeling valued and increase that sense of belonging within organizations and at work. So with that, I'll pass it to Garin to give us an example of a DEI.
So DEI policies are closely tied to trauma-informed work because DEI policies really recognize that certain members of the workforce, particularly people of color, come to work with a history of trauma. And then once they're there, they can be faced with overt racism and microaggressions. And so, one of the policies I wanted to highlight is from the Minnesota, the U of M's medical school, specifically their Department of Family Medicine and Community Health. And, they recently took a look and reframed their DEI policy, recognizing that a lot of individuals have unique trauma that affects their day-to-day behavior. So they didn't specifically name their work trauma-informed, but it shares a lot of the same principles. And really what they did is focus on their employees, current employees, who they wanted to hire and retain, but then also the people that they served in doing this work. So some of the things that they did in, reframing this in the context of trauma-informed work were, again, reviewing all their policies and procedures, but really looking at it with a focus of inclusion and equity and seeing, were any of their policies and procedures barriers to these things. They also redesigned their meeting processes and protocols so that everyone in the workforce could feel heard. And they also focused on constant communication and recognized that, some of their staff may have language barriers or cultural differences in timekeeping or personal life schedules. And so that can make some people feel excluded or unheard. So really focusing on that constant flow of communication between employees and managers to understand, different schedules and individual needs. So, the DEI policies, it really embodies these trauma-informed concepts and closely ties with the San Francisco policy of cultural humility and responsiveness by ensuring the organization is truly working to understand the background and histories of their employees and the people they serve to create a diverse and inclusive environment.
So as we're wrapping up this hour webinar with you folks, we wanted to provide a really brief example that shows the kind of layers and the pervasiveness of a trauma-informed approach to your work. We've talked about a lot of areas that a local public health department can implement trauma-informed work, and the King County in Washington State is a really great example of this. I'm going to talk pretty briefly about their trainings, but we have links here. So they have infused trauma-informed principles throughout the county in their juvenile court system, in their behavioral health and recovery division, and in their public health department, especially in that work with the homeless and unhoused population. In the juvenile court division, that has looked like rooting their work in restorative justice principles, working on repairing harm and building partnership. In the behavioral health and recovery division, there's a lot of trauma-informed framework in their patient care. And in the public health department, their work with the unhoused community to improve health and well-being has taken a really collaborative and flexible approach. We want to end the way that we had in that middle section, an opportunity for some prompted questions of reflection. Again, just like that other time, please feel free to put your responses in the chat, whether those be comments or questions. But we really want to ask whether or not you think that your organization has already intuitively embraced any of these trauma-informed approaches or values, and where you see any opportunities for growth within your work. I want to, again, give a minute or two here for these comments and questions, and then we have a brief concluding slide, but I'll let you all read that on your way out. So please feel free to take some time here to respond and sit with these questions.
And please feel free to just unmute yourself and chat too, or talk. For me, sometimes I feel like it takes longer to type than to say something.
Absolutely. So sometimes I'm typing my response to a question, and by the time I hit send, we've already moved on. And I would hate for that to be the case with any of you here today. I'm seeing a lot of talk in the chat around telework policies and flexible scheduling. We've all seen a transformation around that these past couple of years, and I think it's moving in a great direction.
Thank you, Carolyn, for the appreciation.
Absolutely. Yeah, this flexible work schedule is there's a lot of support for that. Also, some stuff around healthy meeting practices. And being able to share about your personal life and the ways that might be coming up for your workday.
Thank you, Karen. I would just want to note that people maybe have heard this, but there's new research coming out that has indicated that, 4 10-hour days, or that people are as productive actually working 32 hours as working 40 hours, and that actually in some cases there's been even increase. Some farms have seen increases in productivity when they move to that schedule. So you don't have to think about going to a 4-day work 10 hours, but it might be 32 hours, which I think is like really, really exciting. Yeah, Chris, thank you. You and I were on the same wavelength. Yeah.
And I love that comment, Cassie, about calming break room spaces for direct service staff. I think that's a really important way to show your staff that are really facing the brunt of that work, that they're supported and that they can have a space for self-regulation is really key in order to build that trust with them.
Thanks, Carolyn, for the comment about the struggles working with school, and Jamie or Jaime about the comments about struggles in local government too. All right.
This is really great, everybody. Thank you.
Sorry about that. Didn't mean to switch out of, yeah, so these are the conclusions. When we'll wrap things up. Emma, did you want to take us off?
Yeah, absolutely. Please feel free to continue talking in the chat while I just kind of go through some takeaways of today's webinar. We really wanted to highlight the way that stress and trauma are at play in our everyday interactions as people. And in order for us to bring our whole selves to work, we need to have practices and procedures that infuse compassion and intention into our workplaces. This will create not only a more engaged workplace, hopefully, but also a more productive one, as I'm sure that we've been able to see in our own lives. I think that through gathering the policies and practices for this webinar, my team and I really realized that policy can help make simple organizational practices concrete and make sure that trauma-informed approach isn't just something that's happening with one person or the other, but it's really infused in your entire workplace. And that has the ability to make systems level culture change in your organization towards the kind of care and compassionate goals that you have for yourselves and your community.
With that, we want to say thank you, everybody. Thanks for staying, for those who were able to stick on for a few more minutes. And we appreciate your time and attention. Oops, and the slides will be posted on Basecamp and on our website. Thank you very much.
Thanks, everyone.
Thank you.
Thank you all.